All right, everybody, 9 o'clock, we're going to get started. Welcome to our presentation, Intergenerational Trauma in American Indians, what every emergency physician would know. It's a lot to cover, but because it's such an important topic, here we are on the final day of SAEM, early in the morning for 20 minutes. So we're going to give you everything you need. None of us have anything in particular to disclose relative to this, and I'm going to hand it off to Dr. Wyatt.
Good morning, everyone. Thanks. I'll echo what Jim said and say thank you for providing us a space to talk today. This is an important talk to us for a couple of reasons. Number one, we care for a large number of American Indian patients at our Level 1 Trauma Center in Minneapolis. About 5% of our patient population identifies American Indian, which doesn't sound like a whole lot, but trust me, it is. And the other reason is that we identify as American Indian, so this is important for us. The majority of this talk amounts to a history lesson, which is, it has to be that way. And that's largely because all of us in this room aren't really in the same point of the journey to really understand the true history of American Indians in this country. And, over the years, a lot of American Indian history wasn't taught in schools, at least that's how it was when I grew up. But what may have been taught was inaccurate. And so that's led to a lot of biases against American Indians throughout history. This first slide, this concept of you are on native land is an important one because we really all are on native land when you think about it. And we'll talk a little bit more about why that's important. And one of the things I always tell people when you're thinking about American Indians, among other groups of underrepresented minorities, they're unique, and they're unique because we were colonized, and the colonizers never left. And so it's this relationship that American Indians have with colonizers that really lies at the heart of many of the disparities that you see today affecting American Indians, and certainly health disparities. This is a famous schematic map by a professor from LSU named Sam Hilliard, where he basically shows in time lapse all the lands that were ceded or taken from American Indians throughout the, I think, 17th century to now. And so removal of American Indians from ancestral lands definitely contributes greatly to intergenerational trauma. For instance, I'm an enrolled member of the Shawnee and the Quapaw tribes, but neither one of my tribes currently they're domiciled in Oklahoma. It's Indian territory. But neither one of my tribes, their ancestral homelands, were in the Ohio River Valley and in North Carolina. So there's a lot of this displacement that went on early on in history, which is, again, weighs heavily onto intergenerational trauma. And then two things that I think about when I look at this map. The first is that it's indisputable, meaning it's history, it's historical, and then the other word is inevitable, and that's largely because of the policies that the federal government adopted against American Indians. So this slide has many of the really important dates affecting American Indians in the country, and I try to include everything on one timeline. It needs to be updated a little bit, and we could spend hours talking about each individual point on this timeline. A couple of things to point out. In 1492, at first contact, there was between 10 and 12 million people on the continent, kind of depending on who you read. Early part of the 20th century, there was around 300,000. So 10 million to 300,000 in a relatively short period of time. And then, the question we should be asking ourselves is why? And certainly it's multifactorial. There's a lot of things that contributed to that, wars, disease, but I think the thing that I wanted to highlight today is this concept of boarding schools. I would like to do this, so a show of hands in the room, those of you who are familiar with and have read about and understand government-sponsored boarding schools, just raise your hand. Great. Seems to be more and more these days people are raising their hands because it's becoming an issue that, a national issue for our country, for Canada, so it's really important. So the concept of boarding schools was really to try to assimilate American Indians and to try to assimilate them so that their way of life, their economy could be changed so that they could tolerate having less land, because land was what was really, colonizers really wanted the land of this country. And this gentleman here, Captain Richard Pratt, was put in charge of developing boarding schools. And his background is in the military, obviously, but he also had a lot to do with developing the prison system in Florida and the penal system. So other sentiments other than this one that is up on this slide, another common one that was kill the Indian, save the man. So this was actually, these things were talked about at the highest levels of government. Now this is a famous picture of the first class of American Indian students at the Carlisle, Pennsylvania boarding school, which is the first federally sponsored boarding school. And, obviously things to point out, short hair, no long hair anymore, military uniforms, kind of the orderly lineup. Because really, when you think about what boarding schools were meant to do, is really to try to erase the culture from, an entire race of people. Cultural genocide is a way to describe it. And, these children were taken many times forcibly from their homes and translocated across the country. Had their hair cut, forbidden to speak their language, forbidden to practice their religion. Many types of abuses are well documented, emotional, physical, sexual abuse, and many children died or were killed. And this is a slide reflecting work from a very famous American Indian academic, Dr. Maria Yellowhorse Braveheart from the University of New Mexico. And she describes phases of intergenerational trauma. And the boarding school period is something that she pays a lot of attention to, and for good reason. You can see, destroyed family system, beatings, rape, prohibition of native language and religion, lasting effect, ill-prepared for parenting and identity confusion. So, I think that, again, using the boarding schools is a very good example of intergenerational trauma is an important one. And what's important to remember is that this didn't happen that long ago. It's pretty common to find tribal elders these days who were survivors of boarding school. And I think that many American Indians have been touched, if not all of them, in some way by boarding schools, either by being a survivor or a descendant. So I'm going to bring up Dr. Robinson now to continue.
Morning, everybody. My name is Aaron Robinson. I'm from the Menominee Tribe of Wisconsin. So why are we talking about this today, and why is this history important for emergency medicine? Well, it's been clearly linked that there is a relationship between historical trauma and poor health outcomes as an adult. And it's very well known that American Indians are stricken with most of the social determinants of health that we see as emergency physicians every day. A lot of these are a direct result of policies put in place by our federal government. From the recent COVID-19 pandemic, American Indians had the highest crew death rate of any race across the United States. Also, as a whole, we have the lowest life expectancy at around 70 years. This is a landmark study from 1998 that I'm sure a lot of you are already familiar with, but basically it followed about 17,000 patients, and it linked that poor or good child health outcomes were directly related to bad health outcomes as an adult. More recently, the study of epigenetics is a very popular one in population health, and we're learning that not only is your life experience important, but genes are either expressed or suppressed based on your life experiences that are either good and bad. And what we're seeing is that we can actually pass these bad experiences and these bad genes onto our offspring, so the cycle continues at a genetic level. So what can we do about this? Well, first, we have to acknowledge it. This is Secretary Deb Haaland. She's the first American Indian cabinet member appointed under the Biden administration. She is the Secretary of the Interior, which actually oversees the Bureau of Indian Affairs. And one of her first actions when she was appointed to office was investigating what happened at the American Indian boarding schools in the United States. So we're from Minnesota up here, so this one hits a little bit close to home. This is in Rosebud, South Dakota, and part of Deb Haaland's investigations were investing time and resources into technologies such as radar. And under Carlisle Academy, which you guys saw a little bit earlier, the remains of 9 children were discovered buried underneath the academy. And this is a picture of those bodies and those remains being carried back to the tribal lands for ceremony and burial. As painful as this is actually a good thing. And Dr. Braveheart theorized that we can actually overcome historical trauma. But first, we must acknowledge it, we must confront it and understand it, and we have to release the pain from it. And only then can you transcend it. And I think we're going to see a lot more of this come to light as Deb Holland's work continues. So what can we do as emergency physicians? One, don't be part of the trauma. You can learn about the indigenous history in the places that you work, live, and travel. And this is going to vary from city to city, state to state, tribe to tribe. And we've got a lot of different tribal people and tribal lands around the city of Minneapolis. You can honor indigenous people that recognize we are still here despite the historical trauma and the events of the past of our nation. You can support indigenous organizations in your community, and whether that's through American Indian advocates at your hospital or just direct contact with those organizations, having an advocate is extremely helpful, and we've got a couple of them at HCMC. And you can share your action steps with your friends, family, and neighbors. I'm going to turn it over to Dr. Miner to wrap up.
It's a lot of heavy stuff, right? And it's, like, you know, here we all are. We're in the world we live in, and all these things go on and have gone on. And we weren't there for them, and we didn't, you know, nobody wanted, no, you can't look now and say, like, how could anyone do that? You know, how can that still exist? So what do you do? Like, how do you move forward? Like, you just have to understand that you're biased. And you don't really know you're biased until you know you're biased, right? So one of the first research studies I did on pain a long time ago, we looked at how likely we thought somebody was lying to us to get pain medicines. This is probably 2003 we did this study. And it was an offshoot of another study, because I've been doing research with Knox Todd about how we had disparities among ethnicities. And that was actually new research back then. People weren't really looking at that. And I was shocked when I found that we were about 10 times more likely to say that an American Indian was lying than any other patient in our ED. And I know it was a real finding because I wasn't looking for it, right? When you're doing research and you find something you didn't expect to find, you know it's a real finding, right? And it shocked me because I figured our group we're pretty open-minded. This is a big community in our ED. We've got, it's about 5% of our patient population, but it's a lot of our homeless patients who see on a routine basis. So it's not a strange thing to take care of American Indian in our ED. It's a daily patient. It's a routine patient. And here we were clearly biased. So that kind of changed a lot for me. And I changed our whole department because they said, oh my gosh, we're really bad. We've picked a group and we're calling them liars. And there's no basis. It was just nobody really lies to get pain meds, right? They tell you a different truth. So that's how we knew that nobody was really lying. We asked the doc, how likely is that? There's a visual analysis, how likely are you lying? So anyway, you just have to be aware of it. I mean, it's hard to be aware of it. You might not naturally be aware of it. Next is to think about all the reasons that American Indians have so many health disparities. Doctors Robinson and Wyatt really presented a lot of the background data, and there's going to be some unique aspects in every community, and it's just something to think about. It's not that simple of a problem, and it ranges from just enormous poverty and isolation from the community, and from the rest of the community, and low access to health care, to much more simple things of people who are more engaged in the typical community around your hospital, but have a background that's isolated them or confused them or made things more difficult. So you just have to understand it's there and think about it. How do you do that? You just ask. It's okay to say, how has this affected you? What's gone on in your life that gets in the way of this? When you're taking care of yourself, the mirror image of yourself, everything goes perfect, right? Because you know exactly what you do and don't know. You know what they mean by every little thing someone says or does, and you don't have to read anything to anything, right? the more different somebody is from you, the more you have to really ask specific questions. Like, what did you mean by that? When I say this, how do you understand that? You have to be much more careful. So you have to spend a lot more time and not assume your judgment's going to be okay and not assume you can take one look and just be right. A bunch of our colleagues, have been presenting research on how a physician gestalt of whether or not someone has sepsis is more effective than any of the sepsis tools we have. We all use that every day in our work. It's totally routine for us to look at someone and guess. Maybe that's okay for shock, maybe that's okay for sepsis, but you want to be really careful because that's where your biases live. And it's a valuable tool, and you don't want to deny that it exists, but you also have to say, hey, this is my bias. So the more different someone is from me, the much more likely I am to mess that up. Other things are much more specific. Recognize that multiple family members come to the hospital when a loved one's injured, and identify a liaison in the family to make them your ally. So you're not, if you get an American Indian family's in with a sick patient, you might not necessarily be seen as the trusted caregiver that you're assuming they're going to see you as. And you want to find an ally quickly and let them do a lot of the communication for you. And establishing a relationship with one person where you can more specifically ask questions, make sure you're saying and doing the things that are going to be meaningful and asking the right questions is much easier than trying to do that with a group, and you're not going to be able to figure out an emergency. So find an ally, and a lot of times someone will present themselves as a leader who will engage with you. The other thing is at your institution, advocate for better cultural policies. You just need to ask the community, what is our hospital missing? What do you do? What do we don't do? And our hospital tries really, they try hard, but we still have a long way to go. I had a friend die last fall, and I was in the hospital with all American Indians from the western side of the Twin Cities, just because we just all knew each other from high school and stuff. We're old friends. And I didn't come in and say, hey, I'm the department chair of emergency medicine, and I don't make it upstairs ever. So people on the floors have no idea who the chair of emergency medicine is. So I'm up there, and I didn't really realize that a group of people that look and talk like American Indians from northern Minnesota would get treated differently in our hospital. Definitely did. People were scared of us. They didn't come in the room. They came in, they'd look at the ground and aggressively say, only one of you can go in there at a time. And I know that happens, but it's my own hospital, and I'm a leader at it, and I was watching that happen. So it's still a problem, even when you're worried about it, even when you're trying. Anyway, I've been talking for a long time. We have time for questions. Please ask a question. Dr. Totten.
Statement. The last boarding school closed in 1997. There are still boarding schools, but they are voluntary, not forced, at least on the Navajo Nation, because it's too darn far to drive your kids every day and you can't get through the roads when it's raining.
And there's schools around today that are now, that started, my college, Dartmouth, started essentially as a boarding school to teach English and farming skills to American Indians in New Hampshire and Vermont. I mean, it's still there today, and that's not their goal anymore, but that was its basis and foundation.
Yeah, thank you for that comment. One of the things that I've talked about before is that the sheer number of boarding schools that we have in the country, right? Minnesota had somewhere around 17. In Oklahoma, I grew up in Oklahoma, there was over 80. I mean, so I think to Dr. Robinson's point, we're going to see a lot more of this work that Secretary Holland has embarked on, so it's important. Other questions? The last comment that I'll make is, whenever you talk about American Indians, the overall theme, it seems like, is to focus on the negatives, which I think that for a talk like this, you have to. But what I really wanted to start talking about more is the positives in our culture, because there's so many positives. And I think right now we're in a time of revitalization in this country as well. You have a lot of people that are interested in Indian languages and preserving them, linguists working with tribes to try to develop alphabets so they can more efficiently pass the language down. Because most languages are phonetic and they're passed down orally. So things like that. every medium of society has Native Americans kind of front and center these days. The culinary world, with James Beard Award winner is American Indian Lakota, who lives in Minneapolis now, with the best restaurant of the year. His restaurant, Awamni, is an indigenous restaurant, kind of focused on pre-colonial diet. Entertainment, Reservation Dogs, all these other movies that have like all native casts and directors and crew. The first female American Indian astronaut just got back from space, Nicole Mann. The literary world. I mean, there's American Indians we're here. So I think that's something that is important also to point out.
Dr. Scott.
You commented all on the status of representation of American Indians in medical schools and emergency medicine training, and where we're at with that.
Not great. So I just gave a keynote speech 2 weeks ago at the University of Minnesota at the graduating medical school class for 10 American Indian students. It's the second largest program of graduating American Indian medical students. The largest is a program at University of North Dakota, InMed, Indians into Medicine. It's the program I went through. I went to medical school there. And Dr. Scott, just to give you an idea, that program came about around 1970. And in that amount of time, only 250, or just over 250 American Indian physicians graduated from the med school. So that puts it into context. It's sorely underrepresented, and I think that's one of the ways to kind of try to regain some trust amongst tribal members. There's a profound mistrust of the healthcare system for good reason, and I think that the more American Indians we can recruit to go into the healthcare field, nursing, medicine, pharmacy, I mean, every across the board, the better it will be for the communities, because to try to regain some of that trust. But it takes time. There are, when people say, wow, I want to hire an American Indian physician, there aren't these large pools of us out there, so it's going to take time, and it's going to have to be very deliberate. Starting early, there's programs out there, middle school to medical school, starting really early and developing programs. We just hosted a program very similar to that in our own institution called American Indian Youth with Stethoscopes, where we got 70 students from across Minnesota and Wisconsin and South Dakota to come, these ages 11 to 18, and spend the day with us at Hennepin Healthcare, and it was a great event. So more of that I think needs to happen.
Well, thanks, everybody. I think we've used up all of our time. Thanks for coming. Congratulations.